Welcome to the What Doesn't Kill Me podcast, a podcast for those with chronic illness, chronic pain, and for those that love and support us. I'm Meg Quinlisk, your host. After 45 years of living with debilitating rheumatoid arthritis and having had over 45 surgeries, I have learned a thing or two. Chronic pain can be a lonely existence. It can leave us feeling alienated and disconnected from others. So just know that this is a safe space. We are going to share our wisdom and our woes. We're going to offer support and advice so that we thrive. Share some insights today into preparing for surgery and helping you know what to expect about your surgery. I'm also going to help you find a surgeon and talk about questions to ask them. We'll talk about pain medication, and we'll basically be covering how to have the best surgical outcome. And that involves so much of your preparation. So stay tuned and give a listen. Hi, this is Meg Quinlisk, your host for What Doesn't Kill Me. What I'm going to talk about today is surgery. I'm getting ready for a big surgery. I'm getting ready for a total shoulder replacement. It's actually called a reverse shoulder replacement because they're actually going to do it in such a way that I also will be taking care of my terrible rotator cuff. So I thought I was going to need rotator cuff surgery, which I think is one of the worst surgeries to have and is so painful and such a long recovery. But it turns out they're going to replace both the shoulder and they're going to take care of the rotator cuff at the same time. And it's less intensive. The recovery time is less. It's pretty much a miracle as far as I'm concerned, because I was anticipating a 6-month recovery. When you're getting ready for surgery, and I've done so many of them, I stopped counting at 45 because at that point, what's the point of keeping track of that many surgeries? But some of them I've had are cervical fusions. I've had 2 of those. I've had 4 laminectomies. I've had a neurotransmitter installed in my back for nerve pain. I had a radial head remover of my left elbow. They took that radial head out, which apparently I don't need, and it got rid of so much pain. I had a rotator cuff surgery done of my left shoulder. That was really tough. I had 2 hip replacements, doing fantastic. That was a great surgery. I had so many bunionectomy surgeries because sadly I went to the wrong surgeon the first time and I let him repeat the surgery several times. So I had bunionectomies done on both my left foot and my right foot, big toe, and hammer toe surgery and smart toe implant with hammer toe surgery. I also had a C-section. I had fissure surgery. I had many cyst surgeries, and I had a double mastectomy and reconstructive surgery. So that's just to name a few. And I'm not going to go into some of the ones that failed and had to be done again, and that's a whole other story. But I didn't do enough research and I picked the wrong surgeon. That's why I have such a number or a high count of surgeries. What ends up happening is when you have rheumatoid arthritis, it attacks the synovial lining around the joint. And in my day, when I was diagnosed at 13, there were no biologic drugs. There were no real effective drugs stopping the progression of the disease. So over time, my joint just wore down to a point where it was bone on bone. So as a result, you get so much pain, there's not much you can do for it. And eventually the joint is completely destroyed and you have to replace it. So I want to give you some advice for when you're going to be going through the process of surgery. Every surgery, no matter how little or small it may seem, is a big deal because they're basically going to be operating on you. You're going to be most likely going under anesthesia. Sometimes you'll be doing a block, which is not a put you to sleep type of surgery. But either way, it's a big deal. But I will say one thing, after having it done so many times, I have had such success. And I've had some failures, but even the failures, they've been able to go back in and fix them. So I am just so happy that they can replace my body parts that are not working anymore. To me, that is the beauty of the age that we live in, is there's so many medical advancements that the worst thing they could say to me is, Meg, you're just going to have to live with that pain for the rest of your life and there's nothing we can do for you. That would be really horrible for me. So I always go into a surgery with a positive outlook. First of all, I've tried to other things like physical therapy. I've tried strengthening it. I've gotten opinions on it. I'm talking about the area that I have to have replaced. Like say for my shoulder, you have an x-ray done, you have an MRI, steroid injections, because if I have a pain, God, I'll take a steroid injection any day. But after a while, you realize if that pain is keeping you up at night and you can't sleep because of the pain and you can't do your normal activities, like even use the mouse on your computer, you start to realize, you know what, it's time I do something a little more drastic because I don't want to live like this. And basically that is kind of what it comes down to. If you're okay living like that and you have more fear of the surgery than you do of having to really cut back on what you do with yourself or what you do in your life, then that's up to you and that's your decision. I'm the type that, man, if they can fix it, fix it. So what I will do is I will find a surgeon. That's probably the most important piece. You ask around, you ask your friends, you ask your neighbors, you ask people that have had the surgery before. And the other way you do it is you look up some of the best surgeons in your area and you read their reviews and you find out, oh my gosh, this guy sounds fantastic. I myself, because I have the arthritis and it tends to be a little bit more complicated than a normal hip replacement or a normal rotator cuff surgery, I tend to go to teaching hospitals because they have the latest research, they have the latest techniques for how they're going to do that surgery. And for someone like me, it's extremely helpful to get the latest technology and to get the people that do it the most, because a teaching hospital, because they do it so often and because they're teaching residents, surgical residents, how to do it, for me, I tend to have a better success rate at those hospitals than I do at a local hospital. Again, that is a personal choice, but I am so close to the University of Pennsylvania Hospital, the hospital of the University of Pennsylvania, and the really wonderful hospitals in our area, Jefferson and other hospitals, that I tend to go there rather than Chester County or Paoli. And that is not to say that you can't have a very good surgery at those hospitals. But for me, because I'm a little bit of a rare case, I tend to go downtown and have it done. So that is one thing. Now, the benefits, like I said, to a teaching hospital is they are in the forefront of medical research. They really are going to be referral sites for the rare and the extreme medical cases. So if you have something that's extreme or rare, and if you go to a surgeon at your local hospital and they're just like, oh no, you don't need that surgery, or we think it's too high of a risk, get yourself to a teaching hospital. To me, that just says that that surgeon is probably not comfortable doing the surgery. So you go and get another opinion and you see what a surgeon at the teaching hospital says. And that helps you determine if the surgery is right and who's the best surgeon to do it. The other thing is people sometimes get worried because they're afraid that if you're at a teaching hospital, the residents are going to be doing your surgery. And let me tell you, that is not true. They're not going to be doing your surgery. They are going to be assisting with the surgery under the attending physician, the attending surgeon. The attending surgeon is going to be the one who goes in and does the complicated parts of that surgery. The surgical residents, they will be doing the things that are much simpler to do, things they're learning, the things they need to be able to do. And the entire time, the attending surgeon is going to be overseeing all this. So you have every right to ask the surgeon that's going to be doing it at a teaching hospital, what part of the surgery do you do and what part do your surgical residents do? It's a very good question. And that also will allay your fears or will make you feel better and feel like, I feel I'm in good hands. I tend to think that because you're in this teaching environment, there are so many people checking on what even the attending surgeon is doing. The residents, they're bright as hell, and they've been through so much training by the time they get into that surgery center. And by the time they're in the operating room, they have been through so much training. So it's not like they pick some guy that just graduated and has a 4-year degree and put him in the surgery center. They don't do that. These residents are extremely qualified. So the residents tend to also keep these surgeons on their toes because they're so inquisitive and they're dying to impress the attending surgeon. So they're going to be asking them questions. They're going to be curious about the cases that they're working on. So a lot of times they'll go out and do more research than even the attending physician has done because the attending surgeon has done this surgery so many times that they don't feel like they need to research anything that's going on with that surgery or that case or that type of surgery. So sometimes what I have found is the residents, the attending surgeon, really engaged in your case, and that can be such a positive. They challenge them and they bring out the best in the attending surgeon. So just remember the whole piece about that with finding the right surgeon is patient and surgeon communication is probably the most important piece of the whole operating experience or the whole surgery experience. You need to know what is going to happen when you go in there and are operated on. Now, you don't need to know every single step, nor do I want to know every single step, but you need to be comfortable and feel like you have been informed and you've talked to them and you feel like I really know what's going on here. And that's really vital, because if you feel confident, things are going to go better. Other thing you have to remember is, say you're having back surgery, get a surgeon who specializes in back surgery, and that would be a neurosurgeon, not an orthopedic surgeon. An orthopedic surgeon is fantastic for hips and knees and ankles, but for something that has to do with the back, go to a neurosurgeon. You have so many nerves in your back that can really get screwed up if you don't go to a surgeon that works with nerves and has an extreme amount of experience with them. So that's really important too. Find a surgeon that specializes in the area you're getting operated on. And even if it's an orthopedic surgeon and you're getting your hips done, find a hip specialist, someone who does hips all the time. The more they do it, the better they're going to be. And ask them about that. Ask them about their success rate. I ask a lot of questions. Once I find the surgeon and I schedule the appointment for the surgeon, and it is going to take you a long time to get an appointment. Just be aware of that. It can take anywhere from 3 to 6 months. So that's frustrating, but that's something to be aware of. So sometimes I can tell when a joint is going to need to be replaced and get to that point where, oh my God, this joint is really getting bad. And we've done shots and the shots just aren't kicking it anymore. So I'll make an appointment, even though I might not be mentally prepared or completely ready to have the surgery. I'll make at least the appointment, because chances are by the time I get to that appointment, which could be, like I said, 6 months, I will be ready at that point. So I will do that. The other thing I will suggest too is, if you really feel like you're going to want to get a second opinion, make an appointment at one surgeon and make an appointment at the second opinion surgeon at the same time, because you don't want to wait until you see that first surgeon that you feel like, yeah, this is the guy I most likely will go with. And I don't think I'm going to need a second opinion. Some cases you may not. You may feel like it's a simple surgery. It's a hip replacement. Do it all the time. I really don't need to have a second opinion. I don't feel like I do. But second opinions can be very, very important, especially if it's something like a surgical fusion or heart surgery, or it's something that's really complicated. So I recommend you make your appointment for your primary surgeon, the person, the he or she surgeon that you think is going to do that surgery. But at the same time, have your second opinion scheduled, because you don't want to wait till you go to that first surgeon and you've waited 6 months and then you make the appointment for your second opinion. Guess what? You're waiting another 6 months. So that right there becomes, it's just too long. You can't wait. Your first appointment with the surgeon, you want someone to come with you to that initial appointment with your surgeon, because they are going to say things and suddenly your brain is going to shut off. They're going to say one thing and you're going to stop hearing what they're saying. No matter how experienced you are at surgery, you're going to miss something. So if you can, try never to go to a surgical appointment, especially the initial appointment where they're going to be talking about what surgery is, how long recovery is, all the details. You're going to need somebody there to hear it too. So I try to bring somebody with me, and I usually will have them record the appointment. I don't even ask the surgeon if I can record the appointment, because that's just my personality. I figure, I don't need to ask. I'm paying for this appointment, so I don't usually ask. Now, my husband, he's a little bit more upfront, and he'll ask the surgeon, okay, if I record this, and if the surgeon says no, it's not okay, that could be a red flag. Like, what do they have to hide, and why don't they want you recording? That to me might say, maybe they have a few lawsuits out there because they got something recorded and it didn't turn out the way that they said it would turn out. So up to you, but I always record. Notes are great too. If you feel more comfortable taking notes, with my hands, I can't write very fast. And the person who's listening, sometimes when they're taking notes, they're missing things too. So usually they will record the conversation I have with the surgeon. So that is very helpful. I will ask questions like, can you explain what the surgery is going to be like? And I'll ask if there are any diagrams or if there's any written documentation on what is going to be done during that surgery. They'll usually be able to find a packet of information for the people that ask, because a lot of people don't ask. Maybe they don't want to know. I really want to know. In fact, I'm weird enough that I would love to be able to watch a video of the surgery, because that's how weird I am. But most people do not want to know, and I get that. But if you're the type of person that wants to know exactly what's going on, ask them for some written documentation on what happens during the surgery. They won't give you every detail. And like I said, you probably don't need every detail. Who wants that, right? Except me, maybe. But anyway, ask them for that detail if you want. They'll give you paperwork for it. Also, I tend to ask them things like, how long is recovery time? How much pain are people usually in typically? Because pain is so relative and so personal. But is this a surgery that people usually complain about a lot? And how long is recovery? What will be my limitations during recovery? And I usually try to go by weeks. Like during the first week, what are my limitations? During the second week, what are my limitations? If they say it's going to be a 6-week recovery, I find out exactly what to expect during those weeks. Now, a surgeon, if they're really busy, will try to rush you through this. And I'm being a little bit cynical about that because some surgeons are happy to answer every question and they're just very, very attentive and understanding that this is a big deal for you and they want to answer your questions. Some other surgeons will not be so kind and will not give you as much time. So what I do is if they tend to rush me, I will say, hey, I have about 5 more questions I need you to answer. So can you please give me the time that I need to feel comfortable with this surgery? You kind of have to call them sometimes on the stuff they're doing because they may think it's okay or may not even realize, but I don't think that's okay. Anyway, so I tend to ask about what each week during recovery is going to be like. I ask about their pain protocol. In other words, how do they treat patients and how do they make sure they're not in more pain than is necessary? That has to do with pain medication. There's a lot to talk about with pain medication. And I will come back to that when I talk about as you're recovering, what you're going to go through with pain medications and how much pain is okay to have during recovery and how much pain is not okay to have. Another question I'll ask surgeons is I will say things like, am I going to be inpatient or am I going to be, can I, leave the hospital after the days in and out? And a lot of surgeries are now, surprisingly, it's like a factory, which it doesn't always make you feel good. But for me, because I've been in so many hospitals and I've stayed overnight, that is such a kind of a dicey thing for me anyway, because it just depends on how many nurses are on staff. I've had some really bad experiences with overnight stays. So I like to get home. And I also think it's a cleaner, safer environment as far as it is being home with less chance of infection. But I also have a great support system at home. A lot of people don't have that. I have my husband who's wonderful. I have my children who will come home and take time off to help take care of me. So that is my personal preference, is to get out of the hospital as soon as possible. Some people don't have that luxury. And some people really feel more comfortable in a hospital and being taken care of by nurses. So that's something you have to find out. Some surgeons are very insistent you stay overnight at least one night. Some are like, hey, if you're feeling good and your vitals are good after surgery, you can go home. And what they'll do is they'll have somebody who will call you and check up with you 24 hours, or can even be 16 hours or 20 hours, but they will call you and check up to see how you're doing. The other thing I do is if I am going to go home, I will make sure that I can have a visiting nurse come afterwards and check on my vitals and check my incision. A lot of people don't realize that your insurance will cover that after surgery, and that's something you need to find out with your insurance carrier. If you do go home from the hospital, even if you spent the night and say you didn't spend the night, it's better for your insurance to pay for those things than it is for you to stay longer in the hospital or for you to get an infection and end up back in the hospital. So I always say I'd like to set up home health care nurse or a home aide to come in after surgery, either the day after or a few days afterwards, and check on my incision, because with being on biologics, even though I stopped them before the surgery and basically they suppress the immune system, you're more prone to infection. And some medicines just make you more prone to infection. So it's nice to have somebody come in, look at your incision, make sure it looks okay. My husband, God love him, he's gotten really good at doing that. It is not his favorite thing. Believe me, if he didn't have to look at an incision for the rest of his life, he'd be happy, which I can't blame him. A nurse looking at it is better than your husband or your kid or somebody else looking at it. So if you can get a home health aide, I recommend it. They also take your temperature. They check out your home environment to make sure you have enough help. I also like to see if I'm going to need occupational therapist, that's an OT, or a physical therapist, that's a PT. There's a big difference between the two of them. An occupational therapist is great because they will come into your home environment and they will see what is safe and what isn't safe. They will, for instance, look at your shower and see if you need grab bars. They will look at the toilet and see if you can get yourself off the toilet. Because depending on the type of surgery you have, you may not be able to do any of that. So it's really important to have someone like that come into your home and take a look at your home environment because you have no experience with tripping hazards. And that's things like if you have extra rugs on your floors that really shouldn't be there and are tripping hazards, they will tell you to remove those rugs and to remove some of the furniture and things that could get in the way when you're getting up at night. In your bedroom, they'll look at how you get out of bed. They'll show you tips and techniques on how to get yourself out of bed after surgery. So they really will make your life easier and safer. And it's an extra buffer. It's an extra protective coating almost around preventing you from falling and preventing you from hurting yourself during your recovery. Physical therapists are wonderful. And the ones that can come to your home, fantastic, because it saves you from having to be driven out somewhere. So if you can get a home physical therapist to come in and work with you on getting your ass up and moving after surgery, that's incredible. Because what I got to tell you, what will happen is as you're recovering, you are going to want to lay there and you are going to get it in your head that it's going to hurt more to get up and move. And I just want to sit and I just want to lay on this bed. And that is probably the worst thing you can do when you're recovering. When you're recovering from surgery, you need to move. Yes, you also need to rest, and sleep is extremely important. But it is so important to get up and move so that you don't have a fear of blood clots. And also, the more you lay in bed, the more your muscles atrophy, and the more your body just kind of goes into this sluggish state. And it really prevents healing. So it's really important to get yourself up and moving. And it can be as simple as walking around your house. It's not that you go out and you walk for a mile or you walk, any distance at all. You could just walk up to your mailbox. If it's a nice day, walk outside. So it's really important. And sometimes it takes a physical therapist to come into your house to get you up and moving. Because there's been times after surgeries where I'm just like, screw it, I'm not getting up. But if a physical therapist is coming and visiting you and they're going to give you an exercise plan, trust me, they can be really tough, or they're kind. I don't mean that they're tough, but they're really insistent because that's their job. They have to make you get up and do things. So I ask about that. Those are the 3 things I check with my insurance, and I make sure that I can have those. And I have them set up. And what happens is the surgeon's office has a company that they will work with, and you can set up these people to come in with your surgeon's office. They will give you, usually they'll give you some paperwork. If these are the home health aides that we use, these are the physical therapists, these are the occupational therapists. And then you call them up and you set that up. The thing I always ask the doctor is I ask them what type of equipment I'm going to need at home. For instance, when I have shoulder surgery, it is much better for me to sleep sitting up than it is laying down. If I lay down, the blood rushes to the shoulder and it really affects the pain level for me. You can sleep sitting up in your bed, but that's not as comfortable renting some kind of either a hospital bed if you're going to be in that situation for a long period of time, or a chair, like a really great, I don't want to say bark lounger, but a chair that actually has a remote control that goes up and down, helps you get up out of it, and also puts you all the way back or puts you in different positions and is very comfortable. Now, I'm not saying you go out and buy that because that would be ridiculously expensive, but there are places where you can rent this type of equipment, and you rent them, they bring it out, you rent it for a few weeks, you rent it for a month, and they deliver it and they pick it up. Another thing is if you're having some kind of foot surgery, you may need a wheelchair, you may need, different types of equipment. You may need a commode next to your bed. So the doctor's office can help you with that, but also the PT or the OT can help you with that. But I don't wait until after the surgery to find out about the equipment because you want it there for when you get home from the hospital. And that's really important. Makes all the difference in the world for your recovery. Other thing I recommend is making sure that you make your follow-up appointment. When you schedule your appointment to have your surgery, make sure they schedule your follow-up appointment. Now, most of the times, surgery centers or doctor's offices are great about doing that, and they know to do that. There have been a few times, though, when they say, we'll call you to schedule your follow-up appointment. Don't do that, because what happens is I have actually not been able to get in for my follow-up appointment because they didn't have space for me, which is ridiculous. You had surgery. You need to see somebody 4 weeks after surgery or 2 weeks after surgery to get your staples out or to get your stitches out, and you can't get in. And I actually had it so bad one time that I had to call the patient advocate at the hospital because I was like, this can't continue. I need to get in to see this surgeon. And it got resolved, but it would have been much easier had I had the appointment made before I had the surgery. The other thing I tend to ask the surgeon, once I've asked about the recovery times, I've asked about their pain protocol. I also ask about how long will the surgery be? How long will I be in surgery? To set the expectation of, is this a really long surgery? And it shows you also how complicated the surgery is based on the length of it. For my shoulder replacement, it's only going to be about an hour and a half, which is great. That's much shorter than I thought it would be. But it also gives the person who comes with you the day of your surgery an expectation of how long they're going to be there. Now, after your surgery, you will go to the recovery room and you will be there for, sometimes an hour, sometimes an hour and a half, sometimes 2 hours. It depends on how quickly you come out of anesthesia, how quickly your body responds to waking up. And when you wake up, you will be really groggy. You will be feeling a little out of it because you have the anesthesia still in you, and you will be thirsty. So they'll offer you something to drink. They'll offer you something to eat. They'll make sure you go slow. They're not going to give you a gallon of water. They'll sometimes just give you ice chips. So I ask about how long I'll, be in the hospital, including the recovery room. And that's always just an estimate. The other question I will ask is, I'll say to the doctor, once I've asked all the questions I can think of, I'll say, what am I not asking you? What have other patients asked you that I'm not even thinking to ask you? Or if your mom was sitting here, your sister was sitting here, what would you tell them to ask the surgeon? And that always kind of throws them and kind of makes them look at you like, that's a very educated patient or a really pain in the ass patient. And honestly, I don't care if they think I'm a pain in the ass. So that's prepping for the surgery. My surgery is going to be on Thursday. It's Monday today, so it's going to be in a few days. So things I'll do to prepare for my surgeries, I make sure that I get out and exercise over the next few days. I'll try to go out for a walk if it's not too painful. I will also try to eat a lot of protein because protein is really good for building up your body before surgery. I will limit alcohol intake. I will also stay away from multivitamins, over-the-counter medications as much as I can. And your doctor's office will give you a list of things to avoid before your surgery. So this is something you'll get from them. But the other thing I try to do is I try to make sure I'm hydrated. I try to make sure that I get enough hydration, that when I get into the surgery, I'm in the best shape I can be, because you're only going to be as good a shape coming out of the surgery or as healthy as you are coming out of the surgery as you were going into the surgery. So the better you can eat, the better quality, the exercising and getting enough sleep before your surgery are really key. I also, right now I've been doing a lot of acupuncture, so I plan to do my acupuncture the day before the surgery because that really relaxes me and puts me in a nice state of mind. And it also just calms my whole system down. So for me, that's something that I always put on my schedule. That or massage or something. You don't want to have a lot of stress before your surgery if possible. Let's see. So that's really prepping for the surgery. Now, I will say this. I am a tough stick. Giving me an IV is really difficult because my veins from years of steroid use tend to move and drop. And I am at the point now where I will not let a nurse put an IV in. And that is not to say that a nurse is not a very good person to do an IV. Granted, they do it a lot of times. Many of them are fantastic at it. But for me, I have been a pincushion for more nurses than I can tell you that have tried to give me an IV. And I know my body better than they do. And they will try to get you to believe that they're the best person at giving an IV. I'm just not okay with that. I don't want to take that chance. So I always let the anesthesiologist know that I want to have someone for their team give me the IV and use ultrasound to find out where the best vein is to get the IV in. I do that and it really does turn out fantastically. The other thing I do is I make sure I drink a lot before surgery. Now, pen or a Hospital of University of Pennsylvania has a new protocol where the day before surgery, you drink big thing of Gatorade. Because of the electrolytes, it's really important you have enough electrolytes in your system, and water does not give it to you. So Penn says, have a big bottle the day before surgery, and then 2 hours before you arrive at the hospital, have another bottle of Gatorade, because that will really help you with the electrolytes, and it'll speed up recovery and getting the anesthesia out of your system. Now, the protocol for many hospitals is still nothing to eat or drink after midnight. And I get that. I understand it, because there's a possibility I would never have anything to eat after midnight, because you definitely could throw up and really screw up. You could really have a problem during anesthesia. But since I've been following Penn's protocol, I have been recovering that much faster, just with feeling less gunky. My IVs have been going better. That's the protocol. It's doing the Gatorade 2 hours before I arrive at the hospital. Now, if I'm having surgery at a hospital that is not part of Penn, that doesn't follow that same protocol, I still will do it. And when the anesthesiologist asks me, have you had anything to eat or drink after midnight? I will lie, and I will say, no, I have had nothing to eat or drink after midnight. Now, I'm not lying about the food, because I won't do that, but I do lie about the Gatorade, because the Gatorade has helped me tremendously. That's just something that I've done. I am not recommending you do it, because I'm not a doctor, and I'm not, somebody who can give a professional opinion. But as a person who's had surgeries, I have noticed such a marked difference. So that is up to you. Okay, let's talk about pain pills, and let's talk about recovering and being on pain medicine. Now, we've all heard the horror stories about opioids and about addiction, and everybody's now has a certain amount of respect for these drugs, which you should. But I will say, you cannot recover from surgery when you are in horrific pain. Your body just won't do the proper amount of healing if it is under constant pain. So they play an important role in recovering from surgery. Having said that, though, the faster you can get off of them, the less withdrawal symptoms you'll have, and the less chance of addiction. Now, addiction is not something that's going to happen quickly with those, most likely for most people. Usually, if you're on them for 5 days or longer, that's when you enter into a fuzzy area where addiction could become a problem. I try to take the pain medicine at least for the first 2 to 3 days, because I know I'm going to need them, because you really are doing some serious, things to your body. So I talk with the surgeon before the surgery about what type of pain medicine I'm going to have. I can't do Percocets. They make me extremely sick to my stomach, and I throw up, and that's never a good experience after you have surgery and you have an incision. For me, I have a pain pill that I prefer one over the other, and I know which one that is, but they'll most likely either give you a Tylenol with codeine, or they'll give you Percocet. So you have to be aware of the fact that they are really hard on your stomach. So you're always going to want to take that with food. Even if you wake up in the middle of the night and you're not hungry, you need to eat something, whether it's crackers or a pretzel or something. Never take it on an empty stomach. It will make you throw up. Okay, the other thing you need to know is you are going to become constipated with these medications. They are going to bind you up like cement. And sometimes that can be worse than anything else with recovering from surgery. So what I tend to do, and they'll tell you to do this, is take Colace or take a stool softener as you're recovering. I tend to take them a few days before my surgery so that my bowels are nice and loose. Now, you don't want to have diarrhea, but my bowels tend to be a little bit tighter, or they tend to have a little bit harder stool. So I know that I really need to up my Miralax, or I need to up my Colace or my Senecot before my surgery. I don't just do that after the surgery, because you're already going to be behind, because from the first moment you take those pain meds, your bowel movements are really, really going to slow down. So that's really important. Take those things. That's an awful side effect of those drugs. Another side effect is you cannot drive while you're on those drugs. You cannot drink alcohol when you're on those drugs. And you can't make decisions when you're on those drugs, because you can be as goofy as hell. So just plan to those first days when you are taking those heavy duty opioids or the things to recover from surgery, you got to chill. You got to relax. You don't have anything major planned, and don't think you're going to be able to drive anywhere. That would be like drinking and driving. So just know that, and they'll go over all that with you. But the one thing I will say is with pain medication, when you are recovering from surgery, it is extremely important to stay ahead of the pain. And what that means is you don't wait to take those medicines, the pain meds, until you're really feeling it and you're like, oh, I'm really in pain. Because guess what? They won't work effectively if you wait too long to take the medicine. So they're going to give you a certain number of hours you take these medicines in. For instance, for me, they'll tell me, okay, take that every 4 to 6 hours or 6 hours. I can't remember. It depends. And it'll be written down and it'll be on your medicine bottle. But say it's every 6 hours. I will literally make sure to the letter I set my alarm on my phone so that I make sure I take those pain meds. Even in the middle of the night, I will set my alarm to wake up to take those pain meds because you don't want to wake up from the pain because you thought, oh, sleep is going to be great. And I don't want to wake myself up. During those first few days, it is really important to get the pain med into you. So I actually set my alarm for the pain, time to take the pain medicine. It's really important to have someone help you manage that in the beginning. I write down the schedule I'm going to keep. I come up with a schedule, like say it's 10 a.m. and the next time I take it is 2 in the afternoon. The next time I take it is 7. I actually write that down and then I put a check mark next to right after I take it. Because believe me, when you're taking medicine that often and for several days, you get to the point you're like, did I take that pain med? Did I not? Oh, I'll just take another one. And that is not a good idea. So you don't want to take too many. So it's really important to have somebody help you manage that because again, your thinking is going to be really muffled. You're not going to be thinking clearly. So extremely important that someone assists you with that process of keeping track of it and maybe even sets their alarm. And if you're 2 out of it and gets you up and make sure you get your medicine, especially if you can't do a lot of moving around because you're kind of sore or whatever. If they can get you your medicine at night, that's really nice. And they can get you the crackers you need to take it and the water you need to take it. That's great. And it's a nice thing for them to do for you. And they can be the one that puts the check mark next to the 2 a.m. medicine time. So that's important. Never get behind the pain. Now, after the first few days, what I'll start to do is if I'm feeling pretty good, and yes, you're going to have pain when you recover. Don't ever think that these pain meds are meant to take all of your pain away. Because if they take all of your pain away, that's kind of dangerous because then you tend to do too much. You're not listening to your body. So they will take the edge off your pain. They will not completely get rid of it. They will take the edge off so it's bearable because that's what we're looking for. We're looking for a pain that you can tolerate and not be in excruciating pain so you can't recover. So it's kind of this happy medium of you're in pain, but it's not so bad that you can't take it. That's what these pain meds do. So you'll be taking these pain meds. First few days, I take it exactly how they tell me to take it. And then what I try to do is I say, okay, I've been on these for 3 days and I'm feeling okay. I'm feeling pretty good. Maybe I can stretch out the time between the last pain pill. Like if it was 6 hours, I can try to stretch it out to 7 hours. And you start with little increments. You don't go crazy and say, I'm going to skip a whole dosage. You stretch it out a little bit. You stretch it to 7 hours between dosages. Then the next day, I might stretch it out to 8 hours between dosages. And it's kind of like a trial and error. But if I find that I've stretched it too much and the pain has come on, then you want to go back. You want to backtrack and go back to where you were taking it. After a while, I get to the point where I realize, okay, I've now weaned myself slowly off of these, not off completely, but I've stretched out enough time. There sometimes is a role for Tylenol to be given with your pain medicine. And that's something the surgeon's team or the doctors will tell you. They want you to take your pain med and then several hours later, take Tylenol. Eventually, I try to get where I'm off of those and I can just take the Tylenol as I need it. Now, for me, I was shocked when I realized as I was weaning myself off of these pain meds, I started to get withdrawal symptoms. Nobody told me that I was going to get withdrawal symptoms. It's not addiction, but you've been taking these pain meds. Your body is used to these pain meds. When you stop taking any drug, if you've been on it for several days, you will have withdrawal effects. So I had to figure out what my withdrawal symptoms were. And my withdrawal symptoms were muscle spasms, muscle tightness, and like anxiety. So I finally figured out that instead of taking another pain pill because you feel this horrible feeling, you really have to be aware that's not pain, or that's not discomfort from where they operated. That's discomfort because my body is going through withdrawal effects. Usually they will prescribe you a Flexeril, which is a muscle relaxer. And they'll give you that as part of your protocol so that when you wean off of these drugs, you won't see the large amount of withdrawal effects that people do have. Some surgeons will just give you or prescribe you the Flexeril and not tell you why you're getting the Flexeril. And I think it's because if they tell you the withdrawal effects, they think people are never going to take the pain meds, and they don't want people to not take the pain meds, because the withdrawal effects, they go away rather quickly. And what happens is you take the Flexeril, it allows your body to relax. You don't have that muscle tightness. It really does work. So just be aware and be really conscious of the fact, and ask yourself the question, am I taking another pain pill because I just feel cranky and I don't feel right in the head? Or am I taking it because I still have this pain that's really bad? And that question, you don't even question that until you've, been several days out of your recovery, or it could even be a week, depending on what type of surgery you have. But that's something to be really aware of. It's very important that you don't get into that slippery slope of still taking the pain meds after you've been, after surgery, after weeks of surgery, that you're still on those pain meds. That could be a real problem. Another thing I try to do is after surgery, I try to have a lot of protein again to rebuild and to recover quicker. A lot of protein. I try to walk as much as possible, and I try to sleep as much as I can, but also buffering that with not laying around too much, not watching TV all day, getting up. I try to get up at least once every hour or two and walk around. So that's really important. So those are some of the things I can think of for right now. And I'm going to be putting together, as I go through this surgery, and I'm going to start filming right after my surgery. And boy, am I going to look like hell. So I'm sure if I can tell you what I'm experiencing, let you know, decisions I'm having to make, things that I hadn't thought of to tell you about, that will be helpful. So I will continue to do that, and I'll continue to record myself going through this process of this joint replacement. So I hope that you found some good information. If you have any questions, let me know. I'm going to try to put some information out there of the PENS protocol with their Gatorade next episode, how I'm doing recovering. We'll also talk about medical bills, and we'll talk about if you have a hospital bill that you can't pay, what do you do about that? If you question some things on your medical bill that you don't think you had in the hospital, we'll talk about how to deal with that. There's a lot of good things that you'll get to hear from me because I've been through it. So anyway, thanks so much for listening. Have a good day.